Greetings everyone. Today we are going to see on the topic complex amalgam restoration. The complex amalgam restoration is basically needed in tooth which has an extensive dental caries or cuspal fracture, where the remaining tooth structure lacks in resistance and retentive features for your restoration to be held. So for that we need various slots, grooves, locks and pins. These are all our secondary retentive features. Coming to the definition of complex amalgam restoration, it is defined as any restoration which requires the placement of one or more pins in dentine to provide adequate resistance and retention form to the restoration. So where all it is indicated? These are indicated when large amount of tooth structures are missing, when one or more cusp needs to be capped, when there is increased resistance or retentive form is needed where the conventional form is not sufficient to provide that, in case if there is a post-endodontic restoration requirement, in teeth with guarded prognosis, and in foundation for full or partial or metal ceramic crowns that can act as an abutment. These complex amalgam restoration are contraindicated in patients with significant occlusal problems such as attrition and lower vertical dimension patients, and tooth which cannot be restored properly because of anatomical and functional consideration, and also in aesthetically important areas. The basic advantages of this is that it offers retention without the need of extensive preparation, and there is also an increase in resistance form of the preparation to some extent, and it is relatively less time consuming than all the other cast. The major disadvantage of complex amalgam restoration is that it can cause dentinal microfractures because of drilling and placing the pins. It can cause microleakage because there are a lot of interfaces present. This can decrease the strength of amalgam, and also during the drilling and placement there can be penetration or perforation which can happen, and there is a little bit difficulty in providing a proper contact and contour. Coming to the clinical techniques of how to do a complex amalgam restoration, we start with the tooth preparation. For the initial tooth preparation, we generally do a cusp capping, wherein for the functional cusp you have to reduce 2 mm, for the non-functional cusp you have to reduce 1.5 mm. Finally, you can also provide dentine slots, coves and locks for the restoration to be held on the tooth. There are different types of pins available: cemented pins, frictional grip or friction lock pins, and self-threaded pins. Coming to the cemented pins, it was introduced by Markley in 1950, and these pins achieve great retention, especially for the large silver amalgam restoration. Here, the pins are actually smaller than the pinhole. That is, there is a small difference between the pin channel which you prepare followed by the pin placement. These are indicated in least crazing or stress area and generally used for endodontically treated teeth, sclerotic or dehydrated dentine. Here you can also bend the pin into U form and L form before placing it in the pin channel. Coming to the technique of how you cement your cemented pins into the pin channel, first you prepare the pinhole, which is then dried with paper points. After drying with paper points, you apply a layer of varnish and let it set. Then you use the luting cement which is introduced into the pin channel using Lentino spirals, root canal file or explorer, followed by which you bend the pin if you need it, or place it inside the pin channel which is coated with the luting cement, and hold the pin using forceps. This is held till the cement sets. So this is a diagrammatic representation of preparation of your pin channel, followed by which the placement of pin, wherein you bend the pin in case if you need, followed by the application of the cement into the pin channel using Lentino spirals and placing your pin. The advantages of cemented pin is that the cemented pins are generally smaller than the pinholes which are prepared, so it can be seated to the full depth, and also it is passively inserted into the pinhole, so therefore there is no stress which is generated in the surrounding dentine. The disadvantage of cemented pin is that it offers less retention when compared to the other type of pins, Since it is cemented, it can be easily dislodged, and also sometimes it is difficult to insert the pin to the full length of the pinhole because the cement generally sets earlier. Coming to the next one, which is the frictional locked pins. It was introduced by Goldstein in 1966. Here the pins are 0.001 inch larger than the pin channel. Previously we saw that the pins were smaller than the pin channel. Here it is larger. It is larger by 0.001 than the pin channel. And here they use the elasticity of the dentine for the placing of the pin. It is generally indicated in vital teeth and periodontically sound teeth only. The technique which you follow here is that you prepare a pin channel with a twist drill up to a depth of 2 to 3 mm, after which you create a marking on the pin using a permanent marker, and the pin is slowly inserted into the pinhole. How? You use a mallet here, which is to apply a force parallel to the axis of the pin, and then the excess pin which is present is cut using a small round burr. The advantage here is that the pins acquire stability from the moment they are inserted, and it has a better retention when compared to that of a cemented pins. The disadvantage is that the bending and contouring of the pin after it is being inserted lead to further stress on the dentine, and driving the pins into the respective pinholes can generate stress in the dentine and can also form cracks or craze lines. Sometimes the pins does not go to the full length of the pinhole, and the micro leakage is higher than that of a cemented pins here. Moving on to the third, which is the threaded pins, which was introduced by Going in 1966. The pins are 0.0015 to 0.002 inch larger than the pin channels. So it is quite bigger than the pin channel, and here again it is retained by elasticity of dentine and indicated only in case of vital tooth. Here the threaded pins actively engage the tooth structure, and there are 6 times more retentive than that of a cemented pins. There are 4 basic designs of threaded pins, which are standard, self-shearing, 2-in-1 design and disposable latch head design. This is the standard, which is a length of 7 mm, which can be cut to a required length after placing using a small round burr. Then coming the self-shearing pin. Self-shearing pin is nothing but it has a small neck at the end which can be cut and removed. 2-in-1 design. Here 2 pins are connected to each other at a joint. They are generally 8 to 9 mm. The first pin shears off after it is placed in the pin channel, and followed by which the part B of the pin can be used for the second pin placement. The disposable latch head is nothing but it has a head which has a plastic sleeve, and it can be used in a slow speed contra-angle handpiece. The pins appear to float freely on the plastic sleeve, so once the pin is hitting the bottom of the pinhole, the resistance which is offered results in separation of the pin from the plastic head. The technique here is that the pin channel is prepared and the pins are inserted. For manual insertion, the pins are actually hand wrenched slowly till its full position. For mechanical insertion, the pins are engaged in a slow speed handpiece and inserted into the pinhole with slight pressure. The ideal pin length is 2 mm into the dentine, 1 mm of restorative material to the pin, and 2 mm occlusal to the pin. So any excess length can be removed using a small round burr. The advantage of this is that it provides maximum retention. The disadvantage is that there can be excessive stress which is created, causing micro cracks and craze lines. When the pin is forced into the channel, it can strip the dentine. If the pin is bent after insertion, it can cause extra stress on the dentine or even loosen the fit of the pin which is placed. The micro leakage is higher than the cemented pins. There are different types of thread made system. These pins are regular, minin, minikin and minuta, and it has color codings and various sizes available. So this is the color coding, which is regular, which is gold, minin, which is silver, minikin is red, and minuta is pink. The other types of your TMS system is that it is regular, standard, regular which is self-shearing, regular which is 2-in-1, minim which is standard, and again minim 2-in-1, minikin self-shearing, and minuta self-shearing. Coming to the pinhole preparation, there are various drills which are available for the pinhole preparation, which is regular twist drills, limited depth twist drills, miniature twist drills, and twist drills with parallelometer attachment. Coming to the regular twist drills, they have a cutting part of 4 mm or more length without a limiting or a shoulder stop, whereas the limited twist drills have a shoulder located at 2 mm preparation. Miniature twist drills are regular or limited depth, but their overall length is basically shorter when compared to that of a regular twist drills. The twist drills with parallelograms are attachments which are regularly helping us to limit the depth and inclination or paralleling of the pinhole preparation. So, number 4 round burr at low speed is used to create the pinhole or the pilot holes, followed by which the pin channels are cut with a speed of 300 to 1000 rpm with a slight apical pressure, and the drill should be removed once indenting and allowing a brief period, that is 10 to 15 seconds. Points to be kept in mind while using the twist drills is that the twist drills become too dull after cutting 20 pinholes, so it is needed to be discarded. Second, the dull drills can increase frictional heat and also result in cracks in dentine. And also, repeated insertion and removal of dentine results in enlarged channel or conical channels. Last, stopping the drill during procedure increases the chances of breaking. So, we need to analyze the depth and do it in one single go. The basic principles of pin placement is that the number of pins, for example, one pin for missing cusp or one pin for missing line angle should be placed. The pin orientation should be oriented along the long axis of the tooth. The pin ratio, that is the ratio of pin length to the dentine to pin length in the restorative material, are as follows. For cemented pin, it is in the ratio of 2:3. Frictional lock pin, it is in the ratio of 3:3. For threaded pin, it's in the ratio of 2:2. The pin site is that it should be halfway between the pulp and the dentino-enamel junction or external surface of the tooth. At least 1 mm of sound tooth dentine should be present around the circumference of the pin, and there should be at least 1 mm of dentinal thickness between the pulp and the pin to prevent any severe inflammatory response. The interpin distance for cemented pin should be at least 2 mm. For frictional lock pins should be at least 4 mm. For your threaded pins, it should be at least 3 to 5 mm. So how do you restore this? The restorative technique is similar to that of your normal amalgam restoration, using a universal matrix or a Toffelmayer matrix, auto matrix, or even compound supported copper band matrix. So this is after placing the pin, you place a universal or Toffelmayer matrix and then go ahead with your amalgam restoration, carving, burnishing, and finishing and polishing. Compound supported copper band matrix is nothing but placing a copper band which helps in the restoration of the silver amalgam after placing the pins. Auto matrix is nothing but placement of prefabricated matrix followed by insertion of amalgam, condensing, carving, finishing, and polishing. The complication with the pins is that the drill breakage can occur, which is generally rare. The lateral stress while drilling can happen. The drills can get dull and the drills can stop rotating while cutting in the dentine. Second, there can be causes of pin breakage, which is excessive force applied while driving the pin, or if the pin is rotated despite being fully seated, or extensive force while bending the pin. Loose pins. Here, repeated insertion and removal of pin drills can result in increase in pin channel, which results in loose pins, and also pin drills rotated extensively in case if self-shearing pin failed to shear, resulting in strip dentine. And the most common thing is that perforation of pulp space and external surface, bleeding from the pinhole, or sudden lack of resistance is felt, or sudden pain while drilling is present, or if pin continues to thread greater than the intended depth. So the failure of pin retain restoration is possible in 5 possible ways. 1. A fracture between the restorative material. Second, separation of the pin from the restorative material. Third, fracture of the pin itself. Fourth, separation of the pin from the dentine. Or last but the fifth, which is fracture of the dentine itself. Coming to the amalgam pins, which was introduced by Chauvel in 1980s, it is generally referred as the vertical post of amalgam anchored in dentine, and amalgam pins offer a similar retention and it is less internal stress which is generated. It does not reduce the compressive or tensile strength of amalgam, but it helps in greater amount of tooth substance or tooth removal is done here. The technique for amalgam pins is that you use an inverted cone burr and create a ditch cut. Followed by preparation of ditch cut, you go to a depth of 1 to 2 mm deep and the width should be 0.5 to 1 mm width. You need to keep in mind that the preparation should be ending in 0.5 mm into the dentine. After preparing this, you use your universal Toffel-Mayer matrix and then proceed with your silver amalgam restoration, condensing into the pin channels and also on the superficial area, followed by carving, burnishing, finishing and polishing. So to conclude, as a clinician, you need to weigh the pros and cons of the techniques which you are using for the success of the long-term restoration. It is your duty to determine, based on the loss of tooth structure, of which type of pin to choose and what restoration to be followed. Thank you. These are the references. Thank you and have a great day.